Hey everyone, welcome back to the Chinese Medicine Podcast. I'm Marie Hopkinson. Today I'm going to answer a subscriber's question about psoriasis, the carnivore diet, and blood deficiency, and what do they all have to do with each other. I am a herbalist and an acupuncturist, and I try to make Chinese medicine easy to understand on this channel. So I'm answering a question from someone who's had a potential diagnosis of blood deficiency and they don't understand what that means, and they're also interested in possibly using the carnivore diet to heal their skin. And so we're going to answer this question. So this person has said to me, Marie, is it possible you can do a podcast on psoriasis? Some say the carnivore diet may heal it. Kindly please explain this condition. Love, heart. Thank you so much. And they say their name. So I did say it's a complicated one in Chinese medicine, but I can do some basic patterns and some diet approaches for those patterns. These are general concepts. It's not a diagnosis for this person, or if you ask me a question, I can't give you a diagnosis over YouTube or Instagram or anything like that. And any diet advice or health advice should be taken in consultation with your own individual practitioner. So what's right for you may not be right for others, and it might be right for you now, but it might not be right for someone else in the future or you in the future, because it's highly individualized medicine. Means that something might be appropriate for you now for a period of time, but not forever. And that's where you need a practitioner to kind of help guide you what's with those things. Having said that, Chinese medicine has a lot of stuff to offer for the self-help aspect, and the idea that you're the healer of your own body. And that's what a practitioner is doing. So if I'm giving someone acupuncture or I'm giving them herbs, I'm facilitating their body's natural healing to take place, not sort of doing something artificial to their body, like giving them something they don't have. I'm helping their body, well, that's what I'm intending to help their body to do what it's supposed to do. So a couple of questions or concepts came out of this little discussion that we had, and I think they'll be useful to kind of understand this. So in Chinese medicine, we're going to talk about the skin and how it relates to skin, like how skin problems relate to the organs in Chinese medicine, these patterns. So there's two things to think about with your skin. One is your lungs, the metal element, and the second one is blood. Blood nourishes your skin. Your lungs' job in Chinese medicine is to moisten the skin, provide the moisture of the skin, moisturization of the skin. And they do that through sort of distributing that moisture. So you drink liquid, and then your body has to sort of distribute that liquid around your body. Now, this is a metaphorical concept. It's not like your lungs are actually like doing that physically, but the idea of this, that this needs to happen. And if we don't have moisturization of our skin, that's usually the first place of discomfort and disharmony that will happen, of illness that will happen. Our skin will dry out. Remember that Doctor Who character that was just the skin, like this oldest person in the world, and she was like just a big piece of skin stretched out saying, moisturize me, just needed to be sprayed all the time, ended up dying, I think because someone forgot to sort of spray her, something like that. So that's hopefully not the dryness level that you have, but if you don't have moisture, your skin will dry out. Now, your lungs provide that moisture, but also blood provides that moisture. But blood is like a much thicker, deeper fluid. And you can drink water, hopefully you're not drinking blood, but you can't just kind of create blood quickly, right? You can drink water and get fluid very quickly, but blood takes time for your body to make, right? So you've got to make the blood cells. We get into the science of it if you want, but like your bone marrow actually creates the blood. So your blood has, different components in it, red blood cells, white blood cells, all that sort of stuff. So when you're given a diagnosis in Chinese medicine of blood deficiency, this used to perplex me a lot as a student of Chinese medicine. I was like, what the hell do they mean? Blood deficiency? Does that mean I have less blood? It's actually the idea of this concept that your blood is less quality. And there's some things where you have less quality blood and it's easy to detect with a blood test, right? Like you have less blood cells than you normally should do. So your red blood cells might be shaped, the morphology or whatever's shaped wrongly, like they're not functioning properly because their shape is wrong. Like those are things like called sickle cell anemia, where you actually have a condition that can be diagnosed through a particular parameters of things. But there's things in Chinese medicine where we say, well, those symptoms are relating to blood, but we don't know if that person has anything actually wrong with their physical blood, because Chinese medicine doesn't go about taking blood tests, because they didn't have blood tests in the Han Dynasty, and that's where Chinese medicine comes from. The idea of these metaphorical concepts are still valid to diagnose. It's just they're diagnosed often through the pulse. Now, the pulse is something that's going to show you, a practitioner, very clearly if a person's blood deficient or not through the shape of the blood vessel itself. So one thing that happens when a person has blood deficiency is often the actual vessel, we're talking about the artery in the wrist, is that actually gets smaller. Like there's less blood pumping through that vessel, and it gets very small, and that's where a practitioner calls that a thready pulse or a thin, fine pulse. Like there's not much force to the pulse. That could be part of it. And we don't need to get into all the details of it, because with Chinese medicine, pulse diagnosis is very detailed. But that's part of it. Another type of pulse that can happen when a person's blood deficient is their pulse actually gets really giant, but it's like hollow, kind of feels like there's not much substance there. And that can happen a lot with elderly people as well. Like people, as you get older, you age. That's not what I meant to say. The obvious. As you get older, your body dries out. As you age, your body dries out, right? It gets more blood deficient, because if you didn't, you would probably last forever, and that's not what happens. So that natural aging process is a drying out process, which is part of blood. Like the lack of blood to moisten us, dries us out. So getting back to the psoriasis question and the carnivore diet. So one thing that was mentioned in the little discussion that we had was, I asked her, had she used the carnivore diet by itself. So one of the issues was the potential of meat making the system more hot and feeling very uncomfortable from that with the psoriasis. And it turns out that they hadn't used just a meat diet. Now, I'm not proposing that you should use just a meat diet. That's what the carnivore diet typically is. You've got variations of that. You've got this lion diet, different kind of variations of carnivore diet. But if you're just having a meat-only diet, then you're just testing that one kind of variable. Again, I'm not trying to propose that that's what you do, but there can be a difference between a food coming into your body by itself and a food coming into your body with other things in there. We don't know is it the food reacting with these other things in there, or is it that, that food kind of by itself. One of the things that this leads me to think about is the unfortunate difference in the quality of foods that we have today, on average, kind of available to us, versus even 10 or 15, 20 years ago. Now, some of the damage that's been happening to our food has been happening over that time, and people haven't been either aware, or it hasn't been cognitive enough, like it hasn't been as prevalent. But now, like, it's hard not to get foods from the supermarket that are not genetically modified, that have not been sprayed with pesticides and chemicals, to herbicides and things like that when they're growing. Sometimes the washing of those fruits and vegetables isn't enough to get that stuff completely off, and plastics in our foods and all these things, right? So I don't want to make this a doom and gloom video, but that's something I've been thinking about for a while now, because the advice of how you would eat in the Han Dynasty, you eat that food today, it's not the same food. Like an apple now isn't the same as an apple back then. The storage of food, that kind of stuff. And then let alone what we're doing to foods with our own productions. Now, I think you can actually mitigate a lot of those circumstances by a few things that you can do for yourself. So if you're growing stuff yourself, what you can grow yourself, and you're eating that stuff, that's good. That's healthier. You're having it fresher. So you're getting all the yang from the foods straight away, rather than having it being stored and there to be some kind of chemical or process in the storage of it, even possibly that you are able to miss out on by growing it and picking it and eating it yourself. So that's possible. And I think that can kind of help. Things like having your own chickens and having your own eggs that come from those chickens is so much better than the chickens that you don't know what they're doing to them, and that you get in the eggs at the store, that kind of stuff. So that's one thing to think about, and I don't want to make this video all about that, but that is a concern, and sometimes that's why I think when people go on these very extreme diets where they're just having meat and that's it, they feel so much better. Why? Because sometimes it's not just the meat. The meat's giving your body something enough to survive on, enough to make what your body needs out of it, but it's just because you're simply eliminating all this other stuff that you would normally have. If you've been watching my channel for a while, you might have seen that I've done 75 hard, which is, you can watch the video to find out what that is. I won't talk about that now, but part of that was I had to pick a diet and stick on the diet. And I made up my own diet, and at the start I was kind of allowing myself, well, the whole time I would have allowed myself to have carbs in the diet. It wasn't strictly keto, the whole thing. But over the time I noticed I didn't need those carbs as often, and I was feeling better not having them. So I was having much more, like the last month of the diet versus the first 2 months of the diet was much more meat-based only. Some days that's all I would have. Some days all I would have would be maybe some eggs and meat and some salad, or just sometimes even just meat. And that's all I would have, like steak or lamb or something, chicken. So I definitely noticed a difference for myself. Now, I'm not saying I did that strictly. That's all I had. I still had coffee and things like that. So I do think that meat can help repair your body if you're going on one of those carnivore kind of diets because of possibly the meat itself, but possibly we don't know really. Is it just because you've eliminated all that other stuff that was possibly irritating your body? There also is a case to be said for doing something for a time to allow your body to heal and then being able to go back and having the other stuff. Now, you might do something for a time, allow your body to heal, and then realize, like I did, hey, I don't actually need all this other stuff that I thought I needed before. I thought I wanted it, but I don't really want it. And when you don't have something for a while and then you reintroduce it, you can really notice what it's doing to your body. That's more truly treating yourself as a healer yourself, or as a observant practitioner. So Chinese medicine was designed to be a system where the practitioner observes what happens by observing what happens. And you can't really observe many variables at once and then make a conclusion. You might observe 3 or 4 variables at once and then go, well, I need to isolate down to this one thing. So, for instance, if I didn't know what all these herbs do and I ate one of these herbs, I will know what's happened. If I get the runs, I'll know it was that herb. Whereas if I ate 5 of these herbs, I wouldn't know which one's given me the runs. I'll know that I got the runs, but I wouldn't know which one of these 5 herbs has caused it. So you kind of have to be taking your time and systematic in how you do that for yourself. If that's what you want to do, be observant and allow that time and say, okay, like for instance, if I did a particular diet thing and I stuck to that diet, definitely, I might do that for 2 or 3 weeks, but I also went through an incredibly stressful time at the time. And I might say, well, that diet didn't help my sleep. I still had terrible sleep, but maybe that stressful time was causing the sleep. And if I wasn't doing the diet, the sleep might have even been worse. Or, other variables are in the mix that you're not really realizing. So sometimes we need to do something for longer than we think we need to do it for to be able to really observe what's been going on. Again, I want to say, if you're going to do any of these things where you're being very restrictive in your diet, you're not having certain foods or something like that, check with your doctor, your general practitioner, your Chinese medicine practitioner, whoever you see as your main healthcare practitioner first before you do this. So I'm not trying to advise you to do these things, but I'm just telling you, if you are embarking on a journey of self-healing and looking at yourself, you have to develop a system that you can objectively do one thing, see what it does, observe on that. Maybe to keep a journal so you can kind of see what's happening and take notes, and you can do a journal like where you go, okay, every day I'm going to write something down about this, or you can make a time once a week where you go, okay, I'm going to journal and like just think retrospectively, well, okay, what happened this week? Oh yeah, I didn't. And sometimes things happen so quickly in life you forget how good you are feeling. Or when something bad happens, like a symptom happens, you're like, oh, that pain's come back again. I noticed this myself when I've just finished the 75 hard, And the last 2 weeks I've kind of been able to do whatever I want, I guess, but I didn't go back to exactly what I was eating before and doing before. But like alcohol is something that I've reintroduced, which I wasn't having. So for 75 hard, no alcohol for 75 days, right? Now, well, it's coming into Christmas time. I want to be able to enjoy myself, go out and do those kinds of things. And so I'm really noticing that now, because it's not something I'm doing on the regular before the 75 hard, where there was too many things going on where I know, oh, this is the only new thing that I've changed. So if I kept my diet the same, but I just have the alcohol, well, I know that it's that. Whereas if I was like, oh, well, I went and had pizza and I had alcohol and I had, I don't know, 10 cups of coffee that day, you don't know what's caused it because there's so many different variables in there. And this is not an easy thing, and it's not what people really want to hear, I guess, but that's if you really want to be a self-healer, that's kind of what you have to pay attention to and make a plan for that. So that's part of it. Now, another thing in Chinese medicine to think about when we talk about blood deficiency, nourishing blood, skin problems, the root of many skin problems is a blood deficiency pattern. It's not always that, but it can be that. It's very commonly that. So there would be needing to nourish blood, and meat is one of the ways that nourishes blood. Bone broth also nourishes blood. But there's something that we have to consider first is if the person's system is blocked up in any way in their digestive system, particularly, like they feel very bloated, they've got like pain, sort of tightness here, especially in their epigastric area. I mean, these are very common symptoms people have anyway, but if they feel diarrhea, particularly like incomplete going to the toilet, like I go and it doesn't all come out, I feel like I need to go again, pain with going to the toilet, constipation, that kind of stuff, that can often indicate that there's a blockage there in their digestive system. There needs to be kind of an opening of that first. And I wouldn't suggest you go and do some kind of strange detox diet. A practitioner will be able to give you a herbal formula that kind of treats that specifically. That's kind of what needs to happen. And that is something that the system of Chinese medicine I practice in the classical system, that's one of the things they do very well. I found that wasn't the case with TCM on the whole, and I'm not saying all TCM practices are the same, but in TCM a lot of formulas, you can see by the types of formulas, a lot of formulas are kind of doing a bit of this and a bit of that at the same time, whereas in classical Chinese medicine, a lot of the principles are like, well, you're either going to be opening and purging or opening or harmonizing, and then you're going to be tonifying, not sort of, oh, let's do this and this at the same time. So giving your body all those kind of mixed messages. You need to be careful if you're doing a detox thing where you're going to give yourself diarrhea from some kind of purging thing. So I'll just leave it at that, but that can sometimes be the case. Now, how will you know that you don't need the tonifying? Sometimes because you feel sick from that, like as in you take the tonif, like if a person did have a lot of meat and that's the only thing they were having, and they got even more blocked or even more stuck, even more bloated, then that could be sort of, part of it. Now, it could be the quantity that you're having. Quantity could be too much. And this person also mentioned something about summertime. And there's definitely a difference they said something like their body easily overheats since childhood from coffee and tea. And I guess that they must have tried the meat carnivore diet over the summer and they felt worse from it. In summer you need less food, usually less heating food and less volume of food, and certainly like lighter meals. So less volume of food in the meal will make it lighter because it's easier to digest. So you might eat maybe more frequently if you were still hungry, but not allow yourself to get that really big, full, stodgy kind of feeling. So this person also says they were told by TMC, traditional Chinese medicine maybe, but that it was heat or wind related. They don't know what that means. So that is a part of skin diseases in Chinese medicine, particularly in TCM, not classical Chinese medicine as much, although we do think about that. Wind is a pathogenic influence from the environment that can come into your body. So why does it come into your body and cause you illness like that? Because your body can't protect itself, and it's kind of invading the layers of the skin first. Now, this would be because the lungs aren't strong enough to protect the skin, or the blood isn't strong enough to kind of protect the skin. So there is a relationship in Chinese medicine between blood and wind, because your blood is kind of protecting your body against the wind. And this is also, people that are blood deficient tend to get colds and flus much more easily. They tend to dislike the wind. They don't like being out in the wind, blowing in the wind. And the wind's often associated with the cold, like wind and cold, because when it's a warm, I live in a place where there are a lot of warm winds, and they aren't pleasant. And that can mostly cause you to feel dry, like it dries your throat, like you're outside walking and it's like, oh, we get these warm winds off the desert that come in and it's like, oh, this is horrible. But you can probably withstand that more than a cold wind. Like a cold wind, if you're blood deficient, you're going on a boat or something and it's like, oh, freezing, let me go inside, get out of this wind, let me take shelter. So there is a relationship there in that way. And this is where the formulas are very different in Chinese medicine. If it's going to be clearing wind and heat, that's a completely different style of treatment to tonifying blood, nourishing blood. Most people will have some kind of blood, like they need to tonify their blood, and they can have that wind heat situation in the skin at the same time. One strategy could say, if you just tonified the blood would be stronger, and the wind and the heat would be repelled and the skin would resolve. That's one way of thinking about it. Another way of thinking about it is to give the herbs or the treatment that kind of clears the wind and the heat. Now, if you're doing acupuncture, it's mostly targeting your body to activate its own response. So it's going to do what it needs to kind of do. It's going to mobilize that blood tonification. It's going to mobilize the blood flow to the skin, which then repels the wind and the heat. You could think of it like that. It would be quite a much longer video for me to explain that wind and heat aspect, but I have made a video about wind in Chinese medicine just in general, and that might help explain some of that a little bit there. But these are very common diagnoses there, but it's not like, oh, here's the wind and heat diet, eat this and your skin stuff's going to go away. Like, it's not really about that. And the wind heat for your diet, the wind heat or the wind cold stuff for diet for colds and flus is not really going to help the skin things. You might feel an easing of some of the symptoms from things like chrysanthemum tea, like these cooling kind of teas, but they're very surface level things, and they're not going to address the blood deficiency. And if anything, if you have a lot of cooling stuff, it's going to cool your system down internally, which is not what you want to happen, because that's going to deplete you more. Like, you don't want to cool your spleen and stomach down. You want to warm it, really, which is why in classical medicine we use more herbs like ginger and that than they use in TCM. I hope this has been useful and helpful to you and explained some of it along the way. I would hazard a guess that the meat by itself is going to have a different response in your body to just adding more meat to what you're already having. So that's one thing to think about. Giving it a sufficient amount of time under the practitioner's guidance would probably be useful. Following the principles that I mentioned before about like noticing what's happening in your body. I wouldn't say that you have to endure difficult circumstances, difficult symptoms, unless you're under the care of a practitioner who says to kind of do that. And certainly if things are getting worse in your body, like I wouldn't kind of press on with trying something. You kind of can go, okay, that's what that thing did. And then you might come back and try it again sometime. But I wouldn't kind of press on with, causing your body more and more kind of detriment. This idea of like there has to be something worse before something gets better. Generally in Chinese medicine, we don't follow that principle. It's very rare to follow that. Like we don't think, oh, you have to go through that but if you do, you need the guidance of a practitioner, because otherwise you wouldn't know, and you could just be getting worse and worse without, you know, the necessity of that. And that can be very hard. It's possible to guide yourself through helping yourself, but there are some limits to that. And with your situation, it sounds quite complex. So I never make videos for people personally to give, you know, I can't give people individual diagnoses or individual health advice. But I'm making this video because I wanted to give general advice for psoriasis, this concept of the meat diet, or the carnivore diet, the lion diet, that kind of thing, and just give those kind of general ideas about it. Something that Chinese medicine is very big on, that I don't think Western medicine really covers very much at all, is like this one size fits all, you know, oh, it's just one body and we're all the same and this is kind of how we should eat. Like, you know, think about Western medicine, they've been promoting that food pyramid for ages, right? Whereas in Chinese medicine, we very much have always thought different constitutional types exist. And your expectation of what a person's life is going to be like the detriments they're going to have, the problems they're going to have, I mean, you know, the benefits of that are very different. You know, and this is why some people struggle to put on weight and some people struggle to lose weight. Why some people are more dry, some people are more damp. These are constitutional types that happen. And you can still be healthy with that type, but there are some people that are going to be fatter than others no matter what they try, and other people are going to be thinner and drier than others no matter what they try. That's just the types of people. Now, that's only just two types, but there are just different things. Again, there's also types of lifestyles that we should adopt in the different seasons. And that's Neijing kind of wisdom, like that's back in the Han Dynasty. Like, you know, we shouldn't live the same, we shouldn't eat the same, sleep the same, and have the same expectation of our body throughout the whole of the year. Like, it's different. Different seasons require different way of thinking and way of living. So I hope this has been useful and helpful to you. And if it has, you can leave a comment below. We can continue the discussion on this video. Was meant to kind of open up a bit of a discussion about that. Please subscribe to the channel. Really appreciate you kind of doing that. And I hope to see you again on another video soon.